We begin at 6 tonight with the uptick in the COVID count.
This after a very busy summer travel season. We've been covering that story all summer long, and local doctors now say they are seeing the increase in COVID in our hospitals as well. Signs that COVID is still very much with us.
Cases were going down in numbers, and all of a sudden in July, they're going up.
In the waiting room of Dr. Leslie Diaz's office, these reminders have never come down. Diaz, an infectious disease doc, was truly one of those local heroes who stood bedside with her patients through every step of the pandemic.
I know that recently we have seen an uptake in hospitalizations as well.
Dr. Diaz says those facing hospitalization this time around are seniors with comorbidities.
Those are the individuals that are getting sicker, they don't recover. We give them oxygen, we throw everything at them as far as, the remdesivir, the antibiotics.
But for the younger, healthier population, Diaz says things are different this time around.
The good news is that the symptoms are less intense than the original symptoms are.
Recent numbers from the state do reflect COVID case counts across Florida have increased in the last couple of weeks. Here in South Florida specifically, this map shows a surge in numbers, with our 5-county area reporting some of the highest in the state. The biggest increase in COVID positivity rates locally, Martin County. The numbers for the week ending July 20th show Martin with the largest increase in our area, 23%. Palm Beach County was next, seeing a jump of 20.1%. St. Lucie County comes in with a 17.2% increase. Indian River right behind it with a 15% jump, and Okeechobee with a 2% increase. Dr. Diaz is recommending that just right now, that you keep your distance from seniors if they do have comorbidities. She says it won't be long, but just for a couple of weeks until these numbers and the prevalence of the virus here in our community does subside. She also recommends if you have travel plans right now, perhaps rebooking. Just delay them a bit, she says, once again, until these numbers come down.